Pneumococcal disease is a huge global health problem. It kills a child somewhere in the world every 30 seconds.
We see a lot of pneumococcal diseases, and many of them come from far away. They come to the hospital when they are seriously sick.
Other than vaccines, we have no other solution. We must invest in vaccines and bring them to children.
If we look into yesterday's admissions, we had 9 admissions, and out of those 9, 7 cases were of pneumonia. And pneumonia is the most common admitting diagnosis in our ward. And among those, of the bacterial pneumonias, pneumococcal pneumonia is the most common one.
In the past, disease rates in children less than 2 are among the highest ever recorded in the world, especially in our Alaska Native population. In the last 5 years, since the use of the pneumococcal conjugate vaccine, we've seen disease rates drop by over 95% in the Alaska Native population. And now, for the first time, we see an equalization in rates between Alaska Native and non-Native children. This has been a great victory. The use of a vaccine has basically eliminated this health disparity, and it's become a tool for social justice in our state.
The world is starting to take it very seriously, especially through the Global Alliance against or for vaccines and immunization, because now we are able to mobilize money, partly through governments who are giving money, and also through the Gates Foundation, who are now mobilizing financial resources to develop the vaccine against pneumococcal.
Currently, WHO estimates that up to 1 million children die each year from pneumococcal disease. And in India alone, it could be as many as 200 to 250,000. We do have a vaccine right now that includes 7 important strains of pneumococcal disease and can start saving lives immediately. We're really excited, though, because we have new vaccines that extend the protection by including 10 or more of the important pneumococcal strains. Those vaccines are going to be available in just a couple of years.
The National Immunization Board has labeled pneumococcal vaccine as the highest priority vaccine for introduction into India. If we get global partnership, India will be willing to put in financial resources, managerial resources, and everything that it takes to make it happen.
What we really need now to make sure that we can get these vaccines manufactured and delivered to every child who needs them is an enormous global commitment by international governments to buy the vaccine. And for as little as $1 billion over the next few years, we can make sure that every child everywhere has access to this vaccine. We're going to face some important challenges in trying to get these vaccines to the world's poorest countries, but the price of inaction is staggering, and the global community just has to step up and make those resources available so that we won't be sitting here 20 years from now saying, what should we have done to have gotten this new life-saving vaccine out faster?